Um, so I have been a little bit under the weather today, and I originally had a topic that I was going to talk about, but I think what I wanted to do was kind of get a feel for maybe what direction you all would like to go. I know podcasts typically are like, you talk about one topic and you have a speaker, but we do things a little differently when we have to do things a little differently. Hi, Lori. Welcome. Um, so so here's some options, and I'm curious to know, like last time we talked about boundaries, and we were looking at, how do you set healthy boundaries um, with people. Hi, Linda, welcome. And so this week, I was really thinking about, I've been reading some research, I get these emails from different listservs and articles of research and things like that. And, one of the things that had come up was a lot of information about how alcohol use is on the rise in women. And a lot of it is tied, to stressors and things of that nature. And so, one of the things that came to mind was talking about, the relationship between stress and substance use, and emotions, because stress can be emotional. And there is a connection because, alcohol is such a pendulum drug anyways, you have like your happy stance kind of few drinks and then, it could go into a depressant. And that's what it's classified as. So it goes from, a stimulant, which people generally say after one or two drinks, they feel relaxed or less inhibited, they're a little bit more relaxed in their mind as well. And then as, drinking continues, it tends to depress the central nervous system and then also become more emotionally laden. And so, I wanted to talk a little bit about that. And then I was looking at, well, I don't know if I have the energy for that because I've been under the weather from this weekend. And so then I was going to do kind of like a little game and play, myths and facts. Like, let's take a look at some myths that exist about substance use and substance use disorders, and then really look at the facts about them. So I don't know if any of you that are on the call with me right now have a preference. There's three options, or I'll just flip a coin and figure it out. But I just kind of want to leave it open to the listeners too.
I'm always down for whatever. Yeah, this is always great conversations no matter what. I will be honest, I do feel like the myths and truths game I would probably fail at. Um, and I don't like failing at games. So
Okay, and it looks like Linda said myths and facts. Love that. Okay.
I would second that. I think myths and facts sounds rather interesting. If it's
Okay.
a quiz, though, I will fail. Like
Well, it's not necessarily a quiz. It's just to see. Okay, well, it doesn't look like I can share my screen. So what I will do though is I will read the myths. I have 5 myths that I wanted to discuss, and some of these we've kind of talked about in previous episodes related to substance use disorders and just general knowledge. But some of them we haven't, and so it might be interesting. So the first one, and I'll put these in the chat box as well. The first one is if it's a prescription, then it's safe and you cannot get addicted to anything that your doctor prescribes. Is that a myth or is that a fact?
a myth.
yeah, definitely myth.
Definitely a myth. And what, oh, okay, it looks like I can share my screen. Excellent. Okay. So I'm curious then what don't look at the screen just yet. But, all right, so we have it's a myth, right? So the fact is that numerous drugs are meant for short-term use only, and prolonged use can potentially lead to abuse and addiction. And this is true in a lot of the categories of substances, particularly the opiates that are prescribed and a lot of the benzodiazepines that are used for anti-anxiety and mostly anti-anxiety and for sleep disorders. I'm not a medical doctor. I'm not a psychiatrist. I'm putting that out there. However, working as a clinician and in academia, these are things that I've generally worked with clients and students and have taught psychopharmacology classes as well. So I just want to put that out there as a disclaimer. But there are a lot of drugs that are meant for short-term use only. And if you think about, like, I mean, some of you may have had the experiences too. I know I've had clients that have come to me needing to get off opiates that they were prescribed from a doctor, after like back surgery or something. And then they found that they were becoming more dependent upon this substance for a variety of different reasons. And we do know, as I talked about before, that substances change the brain. So whenever there's a long-term use of any kind of substance or intense use of a substance, alcohol does the same thing. That it changes the chemistry of the brain, and it also changes the biology of the brain as well. So another fact is that, stimulants, sedatives, and pain relievers are a growing epidemic. And, 1 out of 4 college students illegally use prescription medication. And this is probably higher because these statistics are from 2008. So obviously that was a long time ago. I did not, like I said, I didn't have a whole lot of energy today. So kind of went with something I had prepared before. But, if we think about how, we mentioned even in a previous episode that drinking was on the rise and there were several deaths related to alcohol use. So the idea with it is really recognizing that just because it's a prescription, people still need to be educated about what they're using. And, with alcohol, I wanted to point out too that there are specific amounts that are considered moderate use. And so we'll talk about that in a minute. All right, so the next one, marijuana is not addictive. Myth or fact?
Myth.
Anyone else want
It's definitely a myth.
to? So 1 in 11 people who use it become addicted. So the idea with marijuana not being addictive, it's still a substance. And typically with prolonged use, like we mentioned, that it will change the course of the brain. And so, if you think about it, anything that you do repeatedly as a habit, right, becomes a part of your brain's chemistry as well. And so when that substance is taken away, the brain is going to respond to that. That's when individuals that go through withdrawal experience, that's what individuals that go through recovery experience. The brain definitely, it's an organ in and of itself. And so it's a living, breathing organ that experiences things much differently than our mind does, and our emotions and our spirit does. Our environment is different. So marijuana is addictive. And, with the growing epidemic nowadays, we've even seen some research about, with the legalization of marijuana. There's lots of different research that's coming out about people that are using it socially, recreationally, how it's changing things in the workforce, how it's changing things, just in the social environment as well. I'm curious to know if anybody's had any experiences with this, not necessarily personal, but, know about people or know about individuals that maybe tried marijuana and then became addicted because of it being legal or anything of that nature.
Serena, this is Judy. I had a lot of the veterans about I'd say 30 years old, like 26, 25, let's say 24 to 31, that were trying to go back to school after the Air Force or Army or Marines, and that they had become addicted, and it was really hard. They couldn't decide between that and school. So it was really, yes, like they really couldn't do both, and they was really hard for them to get off the marijuana to concentrate on school. So those were really difficult patients.
Yeah, and I'm so glad that you shared that. So thank you too, because that goes to demonstrate too that when a substance use disorder does develop, it becomes a central thing. It's very difficult for individuals that are heavy users or even dependent users that can navigate multiple tasks or multiple areas of their life. And there, of course, there is a cluster of individuals that are known as functional. So they are dependent, or they do have a more severe substance use disorder, and they're still able to do things in their life. Yet we know that there are still consequences to that, and some of the research has pointed that out. I've worked with individuals that have been functional alcoholics, functional individuals with substance use disorders to different drugs, but really looking at kind of the quality of their life, and how they wanted to change that, and looking at, a lot of the fears that come around from stopping a severe substance use disorder is the withdrawal part, because that can be very scary for people that haven't experienced that. And it could be scary for people that have experienced it too, because it's obviously not a pleasant experience. So it has to do with set and setting. Experts say that it comes down to intention and motivation. And so this is a really big part about substance use in general, is that we know that, a lot of times it's what is motivating a person to use a substance. I mentioned a few minutes ago about how, that there is a relationship between emotional dysregulation and using substances to cope. And a lot of individuals who are in recovery, talk about how substances are a way to not feel. And I even talked about this before, like when the pandemic hit, that experience of loneliness that I experienced was not something I've ever experienced before. And because it was so intense, I ended up drinking more alcohol than I intended. And subsequently stopped drinking alcohol altogether because it was not enhancing my quality of life. And also looking at the intention, what's the purpose of using? Is it recreational? Is it social? Is it to cope with something? Is it to relax? Is it, these are questions that we look at and talk about in terms of how is it being set up in the mind too, and how is it being set up in the experience of it? And there is some research that points to how this can be very different. We know that people that experiment with it who have no experience with using substances, and it's like that first time, that can also be the precursor to what happens to them with the substance. If you smoked pot on the weekend, you will be fined by Monday. So if you take a drug test or something like that.
Total.
Lori says no. Absolutely not. Anyone else? Tuesday. Maybe Tuesday. So we do know that marijuana, and again, given that marijuana is legalized now in Illinois, there are different variations of it. There's different intensities. The THC level is different. It's used for different purposes. But marijuana, as the old school kind of marijuana, it can last for up to 3 days in the body, and it can impair memory, reflexes, and coordination. And we know that marijuana is the only fat soluble substance that exists. So what does that mean? What that means is that it's the only substance that currently exists that stays in the fat cells of the body. So all the other substances pass through, they're water soluble, so they pass through the urine. And marijuana is the only one that stays in the fat cells. And so that's why a lot of times when people, and when I've worked in treatment centers, when people come into treatment and we test their THC levels, right? And so we're looking for their THC levels to go down. And then as people, are not using, or they're working out, or I'm sorry, when they're not using, those THC levels go down. And what tends to happen is that when fat cells are reduced in the body, and that could be because a person might take up, physical activity more, or whatever the case may be, that THC may be released more into the body as well. And so it can also affect the THC levels. We also know that, there is an effect on memory, reflexes, and coordination. One of the things that happens for a lot of people when they use marijuana consistently or long-term or moderate to severe, and some people even experience it the first time that they use it too, is that they get more lethargic as well. And so that could be something that they're not really sure what that's about, that experience of not feeling motivated, excuse me, or not feeling energy, things of that nature. So drugs relieve stress. They help deal with problems. Another fact.
I feel like this one's a dual one, though. I mean,
Okay.
because yes, is it true that drugs can relieve stress when used appropriately? Yes. Can they help you deal with problems, though? Probably not.
Okay. All right. I appreciate that. Anyone else?
I would agree. Yeah. Temporarily relieve stress, but not, it might actually induce more stress.
Yes. Okay. So they don't necessarily relieve stress. And that's the thing that's part of the myth with this is that drugs and alcohol is considered a drug, but we tend to separate them for some reason in society, even though it is a drug. But drugs, including alcohol, actually can cause stress in the body if you think about it. So if you are, let's say you are kind of calm down and, you're relaxed and your blood pressure is 120 over 80. I use that as kind of like the homeostasis level. Like that's your resting point kind of level. And Judy, you could speak more to this too, because you work in the field with that too. So I would appreciate any comments you want to include as well. But so what happens is that alcohol, when any drug is introduced into the body, it's going to cause some sort of dysregulation in the body, right? So we know that when people drink, there's like a sense of feeling warmth, right? So that's part of that also infecting the stress response syndrome or the stress response. We know as an initial stimulant, right? It may increase the heart rate. It may produce, like I said, warmth. It may produce like a little bit more energy. But then as subsequent using occurs, it tends to depress the system. So breathing slows down, right? People get sluggish. People may lose their coordination, things like that. So drugs don't actually relieve stress. They can contribute to stress as well in the body. So from a physical perspective, they temporarily allow an escape from stressful mind thoughts and emotions. But like Ali and Lori said, they don't necessarily, they can help deal with problems in the moment, but not necessarily, I don't know why my thing is not, whoops. Here we go. When the problems, the problems are still going to be there after a moment of escape, basically. And so that's kind of the fact about using. And I think, part of the challenge is, we talked about, when college age kids are going off to college for the first time. I think part of the conversation also needs to about managing stress because college life is very stressful. And it's very new and it's very different. And that's with any situation. People in recovery go through the same thing. Having a new kind of lifestyle, a new life, a different life, that could be also very stressful. Having to do things that perhaps they've never done before can be stressful. Those kinds of things are also important. So it makes sense that people would get triggered when they're in recovery or when they've used alcohol or drugs to help with escaping from these kinds of things. I'm curious what people's thoughts are about that.
Serena, when you're saying drugs, like when I look at that, I'll say, oh, um, like they use the drugs to relieve the symptoms, but they're just covering up the source. So
Yeah.
the source that we need to get to.
Yeah, kind of like a Band-Aid.
Yeah.
Yeah, that's a very great way of putting it. Yeah, so drugs can be it could be a Band-Aid. And I've had conversations with people about the same thing, that it's kind of like a temporary fix. So until the actual problem is dealt with, right? Whether it be an insecurity, whether it be fear, whether it be anxiety. And most of the time it's going to be something emotional, not being able to solve a problem, not knowing what to do. Um, that kind of anxiety, fear, sense of not knowing, uncertainty. Those are all places where people, well, if I could just relax my mind, kind of a thing. I think the emotional experience is also something that's important to just mention as part of the fact with this, is that emotionally speaking, as a society, different cultures have different ways of dealing with emotion, yet emotions are present for everybody. That's what makes us unique, right? And so part of the challenge with that is being able to help regulate those emotions. I used to teach or facilitate a dialectical behavioral therapy group. And a lot of the clients that were in this group, it's a set of skills to help with staying present, being effective in interpersonal relationships, regulating emotions, and tolerating distress. And so that's the premise. It was developed by Dr. Marsha Linehan, and it's a really great skill set too. I mean, I teach it to clients all the time, and help them, gain some of those skills that they may not have had. And one of the questions, though, that a lot of clients have asked me is, why didn't I learn this growing up? Why didn't I know about this? Why didn't I understand this before? Where is this coming from? And I think part of the challenge is recognizing that, a lot of times people don't know how to deal with emotions. And that's one of the biggest things that comes up with alcohol use, stress, and emotional regulation. Lori, did you want to say something?
No, actually, I'm just listening. But there was a slide you mentioned about addiction, and it comes down to intent and motivation. And I would also apply that to recovery, that I think, intent and motivation go hand in hand. I mean, your success in recovery depends on your intent and motivation, as well as, the depths of your addiction. It was a thought that crossed my mind as I read that slide. So
yeah, absolutely. And I appreciate you mentioning that, because it definitely is. And that's with anything, like when we want to cut down on it, when we want to change any habit, right?
Yes.
It is about what is motivating us and what's our intention with it, and we can go through that pendulum of, I don't want to put all this effort into it. And then, yes, I do. Kind of right?
I am surprised by the statistic you just had, 1 in 11, because given, it's legalized now in Michigan here as well. And I know a lot of people in my meetings, that is their addiction that they're recovering from. So I'm surprised at that figure. I would think it would be much higher.
It probably is. Like I mentioned before, these are statistics that are quite a bit older, and dated. Yeah. So because of my lack of energy today, I did not update the statistics. All right. So myth or fact, if you use a substance on a regular basis, you are an addict, or, the more politically correct version is you have a substance use disorder. Myth or fact?
Oh, this one kind of stumps a little bit.
Okay.
I borderline. No, actually, I don't want to borderline say it. Well, because it's tricky, because we use the word substance when we're actually thinking more about addiction or illicit drug usage versus even medication usage. But like, if you're using a medication regularly as it's prescribed, then no, you're not an addict. And it may be something that you actually need for you to be able to function normally. But the way I like to think about it, even when it comes to addiction, by the time that you are starting to use a substance to change the way that you feel, then you are no longer using it for the intended purpose of that substance. Instead, you're actually using it as a way that it's a non-prescription way of using whatever it is. Even if you're self-medicating, if you're strictly using it to change how you are feeling or get you out of where you are at that moment, then those are definitely huge red flags of addictive behavior.
Yeah. Anyone else want to comment on that? Linda, please.
Yeah, I was going to say it's not, at least this is my understanding, it's not how often you use it, but why you use it. So I don't know the answer, though. I don't know if it's a myth or fact. That's why I love this.
Okay. All right. Yeah. Well, no, but that's a great point, right? Is that, you're also looking, so it goes back to what Lori mentioned about the intention, like what's the intent of using? And so if we think about, like, alcohol being such a common substance, in society, and it's so normalized, quote unquote, in our culture here, that, people go out for happy hours, people have a drink with dinner, people, may have a drink before they go to a party. You're looking at, like, it's at parties or gatherings, social gatherings. But the idea is you're looking at, okay, what's the reason that I'm using this, and how often and what's it doing to my life, so it's looking at what Ali said, if you're using it to change your reality, whatever it is that you're experiencing in the moment, that's a very different space. But if you're using a substance, with the intent of whatever the intent is, so if I drink a glass of alcohol or have a glass of wine with dinner, it might add flavor to my dinner. Or I might use it to socialize because, I'm having one glass. Or I might use it to help me, just enjoy the taste of it or whatever the case may be. But for a lot of people, and this, I was talking about my own experience earlier too, is that, I was recognizing that alcohol was more of just escaping that loneliness. Like it was just not like a feeling I wanted to experience because I've never experienced it before until the pandemic. And so when I recognized that, it was like it was taking me out of my reality. And so I had to do something different about that. But yeah, so when we talk about using substances on a regular basis, it doesn't mean that just because you use a substance does not imply that you're addicted to it. There's lots of people that, every time that they may drink alcohol, they may binge on it and they have negative consequences, but they only may do it like once a month or a couple times a month. So that's not a regular basis, but there is some consistency. And so this is one of the reasons why we have criteria that exist in order to determine if there is some substance use disorder that's present, because we ask a lot of questions. As a clinician and someone who specializes in substance use disorders, these are questions that I would ask somebody to determine, okay, is a substance use disorder present based on their responses? And of course, that's, um, considering the fact that they're telling me the truth, what they're ready to share, because sometimes people do not always remember things, or they're ashamed of sharing things, or they feel guilty about sharing it, or they're ambivalent about where they're at the time. So those were the myths that I had for today. I was curious if anybody had any last thoughts. We got about a few minutes left before we wrap up. Anybody? Linda, did you still have your hand up?
Sorry, no. I forgot to lower it.
It's good to see your face.
Thanks.
All right. Well, so next time, I have a few more myths that I'm going to cover and talk about related to substance use. I will make sure that it's updated with statistics at this time so that we have more accurate statistics. And if there are any questions that come up or something that you want to see covered or talk about, I would love for you to reach out to me and let me know. I'm going to put my email in the chat box, and that way any of the viewers on Facebook or people that future view, feel free to reach out if you have any questions or a topic that you are interested in talking about.
Yeah, great discussion, Serena and everyone. I think a lot of people are going to benefit from the myth and fact. It was very interesting. We hope to continue in our 10th session in 2 weeks from today. Yes.
Yes.
Thank
All
you.
right. All right. Thanks, everyone. Thanks for joining. Judy, it was great seeing you or hearing you or you being present.
I'll put my camera on next time.
All right. See you all later. Thanks for attending.
Good night.
Good night.
Bye. Good night. Thank you.